going into our topic, we have our Instagram page and the link is given in the description. Do follow me on Instagram also for more videos and quiz and queries. So, in our previous video, we saw about what is bleaching and the bleaching agents and their properties and mechanism. And in our last video, we saw about intracoronal bleaching procedures, which comprises of two procedures, walking bleaching technique and thermocatalytic technique. So if you missed those two videos, the link is given in the description. Do watch, like and share. So today we are going to see about extracoronal bleaching that is done in a vital tooth. So today's video is totally going to be a vital tooth bleaching procedures. Extracoronal bleaching, that is vital tooth bleaching, is of two procedures, at office and at home. At office procedure, where they use 35% hydrogen peroxide directly on the tooth, and they are commercially available as gel to avoid running on application, and they are mostly activated by light, that is by the procedure thermocatalytic procedure, where this procedure is explained detailedly in our last video and the link is in the description. Do watch if you have missed it. And we have indications and contraindications, where indications are discoloration due to mild fluorosis and tetracycline strains. If it is severe discoloration before restoration of porcelain veneer or bonded resin or crowns, and to match the existing color of the tooth with the natural color. The contraindications are patients with extrinsic strains which can be removed by rubber caps or prophylactic paste, and carious tooth which should be restored, not bleached, and patients with large pulp chamber, and the lactating and pregnant women are not advised to get bleached, and patients with exposed root surface. Procedure. Before going into the procedure, we have to take a radiograph to confirm that there is no presence of caries or defective restorations or exposed dentin or proximity to pulp horns. After the confirmation, we can go into the procedure, where it starts with the protection of gingiva with the help of petroleum jelly and rubber dam isolation. Protective sunglasses are provided to the patient and the operator for their protection, and no LA is advised, and the enamel surface is cleaned with pumice and water. Apply 30 to 35% of hydrogen peroxide liquid on the labial surface of the tooth with the help of small cotton pellet or the gauze, and a bleaching gel containing hydrogen peroxide is usually used instead of liquid to avoid flow on the application, and apply heat with the help of heating device, where the heat is maintained within 120 to 140 degree Fahrenheit, and the treatment should not exceed about 30 minutes, where the tooth should be cooled down at least for 5 minutes after 30 minutes of heat, and pumice is used to remove the residual gel and remove the bleaching agent and irrigate the tooth thoroughly, and dry the tooth and apply composite resin polishing cup for gentle polish, and apply neutral sodium fluoride gel for 3 to 5 minutes, and use fluoride rinse daily for 2 weeks, and bonded restorations on the bleaching surface is avoided or postponed for 7 to 10 days. Lasers or light assisted power bleaching, where the dental lasers and powerful lights are used to enhance bleaching of the tooth, where light curing system generate heat to activate bleaching agents, where the heat causes rapid dissociation of hydrogen peroxide, potentiating the bleaching effect. And the lasers principally work by activation of crystals of the bleaching agents, which in turn causes the release of nascent oxygen, where these systems are used with caution, where this may induce post-operative sensitivity. And when we come to the bleaching of vital tooth at home, it becomes much more easier and less expensive for the patients, and customized trays with 10% carbamide peroxide is used, as it is more stable than hydrogen peroxide, and they may require some documentations of clinical examination, history of dental and medical, and radiographs of the tooth to be treated, and impression of dental arch for the fabrication of bleaching trays, and recall visits for the assess of complications and compliance and progress. Tray fabrication, where the upper and lower alginate impression is taken and the cast is trimmed up to 0.5 inch thickness, and the vestibule region, palate and the tongue region is removed for better adaptation, and reservoirs are placed in the labial surface to provide space for the bleaching agents, and these reservoirs are formed by using light polymerized resin, or it can be formed even by wax pattern to a thickness of 0.5 to 1 mm, and the reservoir should be short of 1 mm from the gingival margin. If wax is placed for the reservoirs, then the cast should be duplicated, as wax will melt if it is fabricated in the vacuum directly, and the material used in the fabrication of tray is thick and semi-rigid plastic material, where the tray is formed from the vacuum forming machine, which involves heat softening of the tray material and vacuum molding. The extent of the tray is dictated by the viscosity of the bleaching agent used. If the bleaching agent is highly viscous, then the tray should be scooped and terminating just incisal to the gingival margin. And if the bleaching agent is not viscous, then the tray is not scooped and it terminates just in the gingival margin. Instructions to the patients, where pre-operative photographs are very important, and the fit of the bleaching tray should be checked, and the bleaching should be done after brushing, and enough bleaching agent should be used. In case of excess on the gingiva, it can be wiped off carefully, and 4 hours for every session and reduce the time in presence of sensitivity. And the tray should be removed from the second molar and not in the peeling action to avoid soft tissue injury. And after bleaching, the mouth should be rinsed and the tray should be gently brushed and stored in a cool or room temperature before use, and the result can be seen as early as in 2 to 14 days, or it may also take 6 to 12 months. Follow-up is important to reduce the complications and improvise the compliance. Adverse effects of extracoronal bleaching are gingival irritation, enamel damage, and tooth sensitivity, where tooth sensitivity can be reduced by use of fluoridated rinse after bleaching. So, if you want me to discuss any other topic, or if you have any clarifications, do leave it in the comment box, and you can contact me through the Instagram page. The link is given in the description, and do follow my Instagram page. And do like, share and subscribe for more videos.